Total knee replacement surgery, or knee arthroplasty, is a procedure that replaces a damaged arthritic knee joint with an artificial implant to help decrease pain and improve mobility, most commonly caused by osteoarthritis. As opposed to a traditional fixed bearing implant, a mobile bearing knee replacement mimics the natural movement of the knee as it flexes. Studies show that after 20 years, 97% of mobile-bearing knee replacements are still in use because of this design.
Hi, I'm Mike Krzyzewski, coach of Duke University men's basketball team. When you hear words like work or hard, don't shy away from them. My players learn to love work when they see results. What's really hard is living in pain, but you don't have to. Consider what your level of play is right now. Now think about how long you can afford to stay that way and still get the job done.
As you prepare for your knee replacement, your surgeon will want to know your medical history in order to identify anything that may affect safe conditions for anesthesia and impair an optimal recovery. It's important to pay attention to your nutrition in the weeks leading up to surgery. Diets high in protein, calcium, and vitamin D help in the bone healing process. In addition, patients should stop smoking or chewing tobacco 4 weeks before surgery and several months after because nicotine has been shown to hinder bone healing. Alcohol, caffeine, and herbals can cause bleeding problems and should not be taken 1 week before and 2 weeks after surgery. Also, some medications should not be taken prior to the procedure, such as anti-inflammatory medicines like aspirin and ibuprofen. You and your surgeon should determine the correct management of medication before surgery. Keep in mind, the outcome of a knee replacement depends on your age, weight, activity level, and other factors. There are potential risks, and recovery does take time. If you have conditions that limit rehabilitation, you should not have this surgery. Only an orthopedic surgeon can tell you if knee replacement is right for you. During knee replacement surgery, the knee is placed in a bent or flexed position so that all surfaces of the joint are exposed. The surgeon makes an incision just above the knee to the edge of the shin bone. The end of the thigh bone is then shaped to prepare for the femoral component, which is a contoured implant that mimics the curve of your natural bone. The top of the shin bone is also resurfaced, then topped with a medical-grade plastic called a bearing, designed to replace the cartilage in your knee. This plastic will act as the shock absorber between the two pieces of metal. Finally, a patella component made of medical-grade plastic replaces the back side of the patella or kneecap. This helps the kneecap glide with the femoral implant when you straighten and bend your knee. After positioning the components as well as checking for the mobility and alignment, the surgeon will secure the implants with bone cement or a press fit that allows the surrounding biologic tissue to grow into the implant. The procedure lasts between 1 and 3 hours, followed by 1 to 2 hours in recovery. Daily activities directly following surgery may include sitting on the side of your hospital bed and walking a few steps with a cane, crutches, or walker. Upon discharge from the hospital, you should be able to straighten and bend your knee at a 90-degree angle and walk with little effort using a supportive device. Your rehabilitation journey continues at home and lasts for 3 months or longer. Physical therapy will be challenging after surgery, but it is extremely important to the success of your knee replacement. During this time, you'll learn how to safely use your new knee joint and return to daily activities. The goals are to improve muscle strength, increase movement in the knee joint, and get you back to your life. 6 weeks after surgery, an assistive device may no longer be needed. Your physical therapist will give you a series of exercises to do at home. By this time, you may also be able to get back to work, begin driving again, and engage in sexual activity. Remember, rehabilitation after knee replacement surgery generally takes at least 3 months.
My surgery has not only helped me as a coach, but it has also allowed me to become a more active husband, father, and grandfather. I was pretty nervous about the surgery at first, but I'm so happy I went through with it. When I returned to physical activity, I was really amazed at the things I could do. How many times do you say, I don't know if I have the time to do it? You can make the time to do it. Why would you want to live with a bad knee? Positive attitude matters. You must tell yourself, I'm not going to let pain win. Listen, I'm Coach K, not Dr. K. Make sure you ask your doctor if a knee procedure is right for you.